Hello, and thank you for joining us on At Issue. I'm H. Wayne Wilson, and for the next half hour, we're going to be discussing substance abuse, and we're going to try to define substance abuse. But let's start with one particular abuse, and that is alcohol. And a recent survey of Peoria County seniors, and their conversation will extend beyond Peoria County, but a survey of Peoria County seniors indicated that in the past 2 weeks, 14% of high school seniors have been binge drinking twice in a 2-week period, binge drinking. 1 in about 7 seniors have done so. To talk about the impact of that on our society and how we might correct that, we have guests from McLean County and from Peoria County. Liz Helton is here. She's the residential unit coordinator for Chestnut Health Systems. Thank you for being with us.
Okay.
Dan Halligus is here. Dan is the COO for Children's Home Association of Illinois in Peoria. Thank you for joining us. Mm-hmm. And Tegan Hewitt joins us, the Director of Behavioral Health Services at Children's Home Association of Illinois. Do you want to tackle the definition to get us started for substance abuse? Is there a concise one? Mm-hmm. No is the answer to that. Okay.
I think it's a challenge. Many people might have different ideas. For me, I think that we look at our adolescents that are using substances, obviously substances that are illegal, and even alcohol to them, and using substances despite the difficulties or the consequences that they're experiencing in their life as a result. Mm-hmm. And as those consequences increase and they continue to use, we start bordering into dependence. Mm-hmm.
And is there a scope of how wide this is? I mean, we were talking about, alcohol is illegal for someone under 21, but it could be just about cigarettes.
Yes, that's an addiction as well. And it's a problem that's been with us for ages and probably will always be with us. So we're continually challenged to try to get as much treatment services out there as possible, identifying people who would benefit from treatment. So it's the scope is huge, and it goes across socioeconomic lines as well.
Before we get into the actual details of substance abuse, we probably should define Children's Home Association of Illinois, what you do, mm-hmm. and likewise follow up with Chestnut Health Systems.
Sure. At Children's Home, we provide level 1 and level 2 substance abuse services. So that means that we are providing intensive outpatient services for teenagers in Peoria, Tazewell, and Woodford County.
In level 1 and level 2, out of how many levels?
Out of 4.5 levels. So we are providing either less than 9 hours a week or more than 9 hours a week, depending on the client's assessment and need for treatment.
And at Chestnut?
We offer level 1, level 2, and level 3.5 services. So in addition to the level 1 and level 2 that she defined for you, we also have a level 3.5, which is our residential facility, and we serve adolescents who are referred from all over the state of Illinois.
Dan, let's look at changes over time. You've been in this industry for quite some time. What kind of changes have you seen, and what concerns you most right now?
Well, the biggest change that I've seen is all of the old 28-day inpatient programs. Most of those have gone away. So that type of approach is pretty rare. So then the level 2, intensive outpatient, that was set up a number of years ago to try to fill a service gap. And in terms of funding, more and more health plans are pretty narrow in terms of what they will cover. And in terms of detox, a lot of detox is happening on general medical floors now, where in the past it would have been on a specific substance abuse unit with people who specialize in that. That's one of the biggest differences.
And why is that good, bad, or?
Well, it's because the traditional inpatient programs started going away. So when someone needs to be detoxed in a controlled setting, they have to be in a hospital. But since these types of specialized units are so rare now, they have to do it on a general med surg floor, and there might not be any addictions professionals available. So it's purely looked at in terms of their safety and their physical health.
What drugs are we seeing an uptick in? What scares you the most?
I think that statewide we are seeing such a drastic increase in heroin and opiate usage that is our primary concern in terms of what our state should be looking at, simply because of how quickly clients can become tolerant of the drug and how deadly the drug is. Heroin overdose can be lethal, and it's incredibly dangerous and can happen very quickly.
You seeing the same?
Oh, absolutely. I would agree with her statements. I'd also just add to that just the amount of, she mentions opiates, so the prescription pills, obviously, but the man-made chemicals, the spice that we're seeing that's ongoing changing. So the adolescents, they don't even know what they're ingesting anymore. And then the over-the-counter prescription pills, which is a huge concern for our adolescents. They're going into stores, taking them off of the shelves, and sometimes consuming 20, 30, 40 pills with the intent to just get high, and they don't have any idea how that's going to affect their brain or their body.
Well, let's talk about the brain. Generally speaking, we say that young people don't have a fully developed brain until about the age of 26, somewhere in that range. Mm-hmm. And so we take young people who are invincible and they have, the brain isn't fully developed, and then they're going through hormonal changes, and we add drugs to it.
Yes, these are individuals that don't always make the best judgments since they're still developing. And of course then comes the at-risk behaviors. And then there's a feeling out there, well, I just drink alcohol, I don't do anything else. However, alcohol is extremely addicting, and it has a detox that is life-threatening as well. So that alcohol is one of the worst.
Are there gateway drugs we should be, as parents, that we should be aware of?
I think alcohol is a gateway drug. Cannabis is also a gateway drug. I think that as parents, they need to be mindful of what is in their own medicine cabinet and what sort of access their children have to these medications, prescribed or not. Because at some point, teenagers will just start looking at home first before they start trying to go find it with peers or trying to find other sources for it or taking it off of shelves. They're going to go to their home first. So parents need to be mindful of the fact that they might have in their medicine cabinet right now gateway drugs.
And I think a lot of people will say, well, you know, that's not true. They're not gateway drugs. And many people are quick to say, well, there's plenty of people out there that just do alcohol or just smoke marijuana. And in my type of setting, we work with adolescents who have gotten to a place in their lives where their usage is affecting multiple areas. Right? You don't come to residential treatment unless it has a profound effect on your life and the things going on in your life. And rarely do I find an adolescent in my 10 years there that used multiple different drugs or substances that did not start with marijuana or alcohol. And I think that's the highlight. That's the important thing. That's what makes us see it as a gateway.
Before we talk more about treatment and some of the other issues concerning that, let's talk about the parents' role then. You mentioned that they start medicine chest. Mm-hmm. Parents should do what?
I think the primary thing is keeping the lines of communication open. You want to be able to have a relationship with your son or daughter where they feel it's safe to discuss things, even uncomfortable things, with their parents. And observing, keeping your eye on things. And it's so easy when you're a busy parent and you're working, you have a lot of things going on in your life, to not observe your child's behavior as closely as you should.
For instance, the parents should, because a parent could say they're going through hormonal issues. Mm-hmm.
Well, what we see is that, during the teenage years, there may be hormonal issues going on, there may be the start of substance use, there may be the start of mental illness, and at the end of the day, it doesn't really matter what's changing your child's behavior. What's important is that you are communicating with them openly about it and that you are providing the supervision and structure that they need to get through that time. Parents aren't going to be able to safeguard their kids or their teenagers from the world. They can't take everything out of the house and then imagine that that child has no capacity to find it elsewhere. So kids will find a way to get access to the substances that they want to try. But if we've already provided that education and framework to the parents of how you're supposed to talk to your kids about this, then hopefully that risk of use is going to decrease.
Should you look for certain things as a parent?
Yes, I think that parents should be looking for significant changes in their child's behavior, perhaps isolating themselves from the rest of the family, changing their peer group, perhaps they're hanging out with a more negative group of peers. Maybe they aren't participating in activities that they used to enjoy, such as a sport or a club at school, declining grades. Any of these factors, it could be attributed to substances or mental illness or normal teenage development, but it doesn't really matter. The parents should still be addressing it with the kid and making sure that they're getting the support that they need.
I found it interesting in that same survey that 1 in 5 seniors in high school said their parents didn't know when they got home at night if they got home late. And that to me just says that parents aren't paying as much attention as they probably should.
Or have these ideas that once they get to a certain age that that they're like adults. You know, I work with parents all the time. They're like, well, they're 16. They need to go out there. They need to experience things. They need to live life. Absolutely. Under your supervision. Right. You should know where they are. You should know who they're with.
At this age of 16, you get a driver's license. There's some sort of transition. Now you're an adult, so to speak. And
One interesting component from that survey was that the frequency of parents having conversations with their kids about substances decreases over time as they age. So parents are doing a lot of this in middle school, but then by the time they reach high school or later high school, that percentage has decreased. And those conversations need to be frequent and ongoing and starting at a very early age.
I want to stay on the issue of parents and the role they play, because at your facility over in McLean County, you have young people from how far away?
All over the state.
The entire state?
Oh yeah. Winnebago County, Cook County, everywhere.
And how difficult does that become to involve the parent? Because I assume the parent is part of a recovery process in most cases.
Oh, absolutely. I mean, we definitely know that kids are more likely to be successful or to experience some level of success in substance abuse treatment with caregiver involvement. It's really hard to take an adolescent from their community, from their home environment, teach them things, give them skills, and then put them back in the same exact pattern, same exact environment, which is more likely to allow them to just fall back into what was. Our attempts to reach parents are endless. I mean, we recognize the value of family involvement. We're willing to open up visiting hours to what works for our parents. There are times when we have our family program, we do phone counseling, whatever it takes for us, we want them to be involved. Getting them involved is sometimes difficult. Our adolescents have reached a point where sometimes they've been to treatment multiple times. The substance abuse has been going on long enough that it's affected multiple areas of their life, and parents are frustrated. Sometimes they feel like they've put in that work, they've tried everything. They don't understand why they should continue to have to do that when they keep getting the same result.
So the relationships become damaged throughout that process, so it gets more and more difficult sometimes.
Yeah, I was good. That's what I was going to ask, is that so that the child looks at the parent and says, "Butt out."
They can, and the parent can also then be uninvolved.
Maybe they're an abuser,
That's absolutely the case in some places too.
which makes your job twice as difficult.
It makes it difficult. I mean, but we're still trying. I mean, maybe they are using, but we're going to still try to work with them and get them involved.
Let's talk about another barrier to this particular issue, and that is funding. Without going into great detail, how do you pay for all of this?
Well, again, private insurance plans will sometimes cover these areas, and of course, Medicaid at Children's Home. We take a lot of Medicaid recipients, and when it comes to the state funding for all of human services, not just substance abuse, we've been getting our budget cut routinely now for a number of years, and it's frustrating for us in Illinois to always be 48th or 49th in the country in human service funding. But as Liz pointed out, we definitely continue to do our best to meet the need regardless of the funding system.
We're that low in state support for
Human services.
human services?
That would be substance abuse, mental illness, developmental disability, and many others.
So let me go back to the issue of you are outpatient services, and over in McLean County, Chestnut is inpatient
And outpatient.
and outpatient. So with outpatient, do you feel like sometimes you don't have enough access to the patient, or is it set up in such a way that there is enough communication to help that particular patient?
I feel that we do the best we can with the resources we have available, but given the lack of child psychiatry in the area, sometimes it can become very difficult. At Children's Home, we're only providing those outpatient services, so we have to refer on for those level 3.5 and level 4 services. Unless you have private insurance, you're not going to be able to get that in your hometown here in Peoria. So we kind of have to work together in the system to make sure that we are providing the right services that children and teens need in regard to substance use.
So is there a shortage of psychiatrists?
There is a shortage of child psychiatrists all over the state of Illinois. There's very few in particular in central Illinois, and we have a lot of kids who need child psychiatry. It's an ongoing barrier that we face in treatment, is trying to get access to child psychiatry in a timely manner.
Are you looking at options to help that situation?
Yes, we are. We're going to be going into telepsychiatry. That's something that has become more and more common, especially in the rural areas where child psychiatry is very, very scarce. So technology helps us meet the need, and we're one of many organizations throughout the country, really, that are going into telepsychiatry.
Also along those lines, if there's a shortage of psychiatrists, that might mean that the particular individual who needs that psychiatric care might wait how long? Months?
Yeah, we try to fill in the gaps and get people's appointments as quickly as we can, but given the lack of psychiatrists, if the primary care physicians aren't working on the treatment team or can't prescribe the medications that a child needs, what often happens is that the child ends up in a state of crisis, they end up in the emergency room, and they could be psychiatrically hospitalized. And this is actually very expensive and costs more than just typical medication management by a psychiatrist.
Are they self-medicating in the interim?
Yes, some are, and that can definitely lead to some of these substance abuse trends and problems that we're seeing here. Oftentimes, people do start to experience their first symptoms of mental illness by the age of 14. In fact, the National Association of Mental Illness said that 50% of adults with mental illness have experienced a symptom prior to age 14. So if they don't have access to the medication that they need, they will go out and try to find alcohol or marijuana or something that helps them cope with those mental illness symptoms that they're experiencing.
Cope defined as ignore?
Well, or self-soothe. Some of these symptoms, you feel better once you have ingested a substance, and whether it's to distract you from what's happening, whether it's to actually calm the physiological symptoms that are occurring in your body, it meets the same need for the client, teenager.
It becomes a matter of doing what you need to get through the day.
Right.
When someone has a serious and persistent mental illness.
But
So-
it means that it's, go ahead, I'm
I was
sorry.
gonna say, so then when you find our adolescents returning to treatment, a lot of times that's one of the key things that come up is, well, I left, I stopped taking my medication, I started using again. Now here I am, and that ties right into the lack of psychiatrists, because they come to us, we find them the right medication, we get them started on the right medication. We have no way to get them the follow-up care that they need so that they can continue that.
You see a fair amount of recidivism?
Oh, absolutely. Adolescents typically return 2, 3, sometimes 4 times to treatment. And as the funding gets more and more challenging, and as people no longer want to pay for residential treatment, the time that we're allowed to work with them decreases significantly. When I started working, we offered a 3 to 4 month program for our adolescents. And I can name a variety of reasons that was helpful for our kids. Now, sometimes we feel very lucky to get, our 4 weeks or 6 weeks.
I'd like to talk about something positive because lack of money, recidivism, the variety of illegal and sometimes legal substances that kids can get a hold of. What about peer pressure? What role does peer pressure play in all of this? I mean, in terms of introducing a young person to some form of substance abuse.
Peer pressure definitely plays a role. But if we're going to talk about something positive, we should also mention that both in the areas of mental illness and substance abuse, treatment works. Sometimes it takes a while. Sometimes it takes perhaps 4 inpatient or residential stays. But through the years, I've seen so many incredible success stories, both in mental illness and substance abuse, where people we thought just weren't going to make it in life turn it around, have good jobs, their own home, families. So the good news is that treatment works.
And if I could just piggyback off of that a little bit, when he talks about not really having those traditional 28-day programs, I think in some ways that's a positive thing too. And I think that over the years, something that I've seen is that there's research out there recognizing that we can't treat adolescents like adults anymore, right? We can't offer that same treatment. And in addition to that, there are these wonderful treatment programs that have been developed and researched and proven to be effective. We have the tools that we need to help our youth. And so those things that we're talking about, the funding and the mental illness and things like that, if we could figure out how to start targeting our youth younger and get some of the resources that we need, we have the tools that we need to help them.
Speaking of starting younger, what about parents communicating? When should they start to talk to their kids about all of these issues?
I think parents have historically thought that middle school is the right time to start talking to their children about substances, but the access to information that children have now is so great because of the internet that there is no time is too early. You can start talking to your children about substances in kindergarten because they're going to hear about it one way or another.
That early?
That early, yes.
That's a 5 or 6-year-old.
And 5 and 6-year-olds, they see people drinking alcohol and they see people smoking cigarettes and they're already asking questions about it. And if the parents don't answer the questions in the way that the child is needing, they're going to find it elsewhere. And they might not, parents might not like the answers that they're hearing from their peers or from the internet or other places where they're getting their information.
And we probably should clarify, we've been talking a lot about substance abuse in conjunction with mental health. Not all substance abuse is with a patient that is necessarily having mental health issues.
Not all, no.
Is there a difference in how you treat them?
I think that at our level of care, an adolescent who does not present with a dual diagnosis, meaning that they're not coming in with mental health difficulties or behavioral health difficulties, then we can focus on the substance abuse. When you're dealing with dual diagnosis, it brings about an additional challenge because we have the short period of time where we need to address substance abuse difficulties that are often almost blocked by some of the mental health that is there. And that kind of has to be worked with at the same time. But we're not really given the time period that's necessary for that level of intensive care.
I'd like to finish up by just, how broad is the problem of substance abuse in Central Illinois? Is there some way of measuring that? Is it growing or?
Well, the survey that had recently come out helps us realize that, yes, it's a very serious problem here in Central Illinois. And we've already talked about the dearth of treatment services and how that complicates things. And when it comes to mental illness, the people that touch these young people's lives, they do not have a background in mental illness, so sometimes that recognition becomes very, very difficult. That's why we have mental health first aid services coming out that are specifically designed to educate police departments, faculties in schools, and other paraprofessionals to help recognize these types of issues.
Recognition and communication seem to be two keys here.
Absolutely.
Before we let you go, is there a website or a phone number or something for Children's Home and then for Chestnut Health Systems?
Sure, you can find all of the information about our services at Children's Home at www.chail.org.
chail.org, and for Chestnut Health Systems?
Yeah, we're www.chestnut.org.
Chestnut.org. And with that, I'm going to say thank you to both Liz and Tegan.
Thank you.
Liz Helton and Tegan Hewitt, Chestnut Health Systems in Bloomington, Children's Home Association of Illinois in Peoria, and to Dan Halligus, the COO of the Children's Home Association of Illinois here in Peoria. Thank you to all three of you.
Thank
It's been
you.
a pleasure.
We appreciate the conversation. Next week, we are not here. We'll be back with a new, fresh show of At Issue when we're going to be talking about renewable energy. I think Earth Day is coming up in late April, so we'll be talking about renewable energy in 2 weeks here on At Issue.